Now we are looking at the part 4 of our metabolic disorders of the newborn. Hypothermia and hyperthermia are problems that occur with thermoregulation, which may be due to multiple factors. Kangaroo mother care is an effective way to prevent hypothermia, where the baby is continually kept skin to skin to the mother, with the mother. And hypoglycemia and hyperglycemia involves abnormal, diminished or increased content of glucose in the blood. And this session will discuss disorders of thermoregulation and kangaroo mother care giving for hypothermia as well as hypoglycemia. Goals and objectives. At the end of the session, the students will be able to explain the disorders of hypothermia, hyperthermia, hypoglycemia, and hyperglycemia. Describe the clinical manifestation of hypothermia, discuss the concept of kangaroo mother care, and also describe the management of hypothermia and hyperthermia, hypoglycemia, and hyperglycemia. So, for the outline of our presentation, we'll be looking at hypothermia, kangaroo mother care or KMC, hyperthermia, which is the same as fever, hyperglycemia, and hypoglycemia. And Wong's Pediatrics has this topic, so you can refer to it and read further. So the first topic we're looking at is hypothermia. So here we'll mention the consequences of hypothermia, demonstrate skin-to-skin technique, mention the benefits of kangaroo mother care. Some said kangaroo father care because fathers too can do it. And then identify and know the time to start KMC, and then the health staff should also be able to prepare. As you are the health personnel, at the end of the session, you should be able to counsel and prepare parents for KMC. Hypothermia is a leading cause of morbidity and mortality in newborn infants of all birth weights and gestation age. So irrespective of the maturity, the newborn is predisposed to hypothermia from birth, because in utero, the child is swimming in fluid, the liquor. So when it comes out, immediately we have to start drying. If not, the child loses heat through evaporation as the amniotic fluid dries up on the skin. So preventing hypothermia starts in the labor room. And we know that in our setup, where the babies are preterm and they also predisposed to hypothermia because they don't have good flexion, the muscle tone is poor, so they are all stretched, and looking at the porosity and the permeable nature of their skin and lack of keratin on their skin, they are predisposed to heat loss. So they are also taken care of in incubators. But in cases where the condition of the child allows it and there are limited incubators, kangaroo mother care is an effective way to prevent heat loss or hypothermia, where the baby is placed in continuous contact, skin to skin. And sometimes it can be done intermittently, so we'll look at it and we'll discuss the various types. So when the temperature of the newborn or a child is below 36.5, then it connotes that there is hypothermia. And we are saying that hypothermia is one of the key, prevention of hypothermia is one of the key interventions for reducing neonatal mortality and morbidity. Because when the temperature falls from 36.4 to 32 degrees Celsius and below, then it is very severe. And this takes a lot of energy from the newborn. And the newborn also cannot shiver. So it cannot generate its own heat. And if it's preterm, it has very poor store of glycogen from the liver, because that is what it must thrive on. And then other muscle store of fat, the brown fat, it has inadequate levels of it. So it cannot produce enough heat to sustain. So we must provide and make sure that the environment is warm enough, the baby is well clothed and wrapped, and then the environment where the baby is also above, environmental temperature is above 25 degrees Celsius. So we're looking from this diagram some mechanisms by which the baby has heat loss. So you see radiation, convection, evaporation, and conduction. So we're going to look at what each one entails. So when evaporation occurs, when amniotic fluid dries up from the skin surface, so it takes some heat from the baby to dry up. So when this happens, or when the baby is also lying on wet cot sheets, it also will lose heat by conduction. So when the baby comes into contact with cold objects and surfaces, so if the cot sheets are wet or is lying on a cold mattress that is not covered, the baby loses heat, or comes into contact with various gadgets during our care that are cold, then the baby loses heat to the various objects that are lying close to it. And so that is a form of heat loss through conduction. And then convection occurs when the cold air in the environment is replaced. It takes heat from the newborn around the baby. So the current air around it, the cold air circulating around it, also takes some heat from the newborn. And this is heat loss by convection. And then radiation occurs when the baby is in close proximity with a cold source in the environment. So let's say if you dry your cot sheets and things in the room and the baby is there, the baby would lose heat to the environment. So it's very, very important that we ensure that even where the baby is also doesn't have air condition, because it can be a source of heat loss to the baby. So 4 mechanisms by which the baby loses heat are the same 4 mechanisms that we can use as intervention to promote heat. So evaporation, in order to prevent heat loss by evaporation, we have to dry the infant or the newborn when it's wet, and then when we bath them, we dry them immediately and close them to prevent heat loss by evaporation. And by conduction, we place the baby skin to skin, and this is where kangaroo mother care comes in. So the baby is in close contact, and even in the labor room, soon as the baby is delivered, before the baby is put on a cot sheet on the mother's abdomen, and that is where it gains some heat from the mother, skin to skin. And convection, when we cover the newborn with blankets, and then also wearing of cap. The head is also another major area where the newborn loses heat. So it's very important that newborns have caps on so that they don't lose heat by convection. And radiation, we keep away from open windows and cold objects in the rooms where the newborn lies. So I hope you've taken note of these 4 major ways the baby loses heat so that we can prevent heat loss. Risk factors. We're saying that hypothermia occurs as a result of some drugs that are given, malnutrition, and then we have also some diabetic mothers or some autonomic neuropathy. So Parkinson's disease comes here, and then overexposure when the baby is not well covered. So the baby loses heat, and then dehydration when the baby has diarrhea or is vomiting. It also will go with some heat loss from the body. And then hunger, because the baby gets hungry, it will cry, and then it will also lose some heat and energy alongside. So what are the signs and symptoms that shows that a child has hypothermia? So the signs and symptoms are commonly or include disorientation or confusion, or the conscious level deteriorates. There is pallor. The skin gets cold. There is lethargy. There is weak pulse when you elicit it. And there is dilated pupils. And if it gets wet, you can have coma. So sometimes it can even result in death. So prevention of heat loss, once again, we're saying that provision of warmth. We dry the baby thoroughly after bath. We place the baby. We have talked about closing the curtains, feeding the baby on demand, and covering the head, and all that are some ways that we prevent heat loss. So complications of hypothermia can have brain damage. You can have reduced cardiac output because it loses a lot of energy such that it affects the cardiac output. You can have coma and even death. So the next topic we are looking at is kangaroo mother care, what we popularly call KMC. And this is an intervention method to prevent heat loss. Kangaroo mother care is an effective way of preventing hypothermia where the baby is in continuous skin-to-skin contact. We have said that. And according to UNICEF, about 18 to 42% mortality and morbidity is due to hypothermia. And so with kangaroo mother care, we can reduce this morbidity and mortality by this great margin. And here, the process helps the baby to gain some heat from the mother through conduction and convection. And also, the baby is in continuous contact with the mother. And when it is placed there, you can even hear the mother's heartbeat, which serves as some music, and is very comforting. So whilst the baby is there, very few people can come and touch the baby. And so we prevent infection. And also, when the baby is also there, it promotes love between mother and child, that we call bonding. And also, when the baby is in upright position, there is also reduction in aspirating food that it regurgitates. So it's very protective. So when can we start kangaroo mother care? Ideally, if the child's condition allows it and can tolerate it, we can start soon after birth. And I've said that even at the labor room, the baby is born onto the stomach or the abdomen of the mother by placing a clean cord sheet such that the mother welcomes the baby by holding onto the baby on the abdomen or on the bare chest. And then the sick baby, KMC, will also help to delay certain medical complications. So even the sick baby can also have this, and it will help. So the length also vary. It can be interrupted when the baby will be placed there for an hour and then will be put back in the cot. Or the baby can be there throughout the 24 hours, and then when there is a need to feed the baby is put to breast. When the baby poos, the baby is changed, but the place where the baby is kept throughout the day is in between the breast, on the chest of the father or the mother. So there are various ways of looking at it. So what do we need for us to implement this? All we need is, first of all, the mother and the baby, or the father or significant other involved in the care. And all they need is the binder or a cloth, a piece of cloth, and then a dress for the baby, and then a dress that the front can be opened. And then that is for the mother, so that she can have the front open, and then the baby will be placed there, and then she'll close it again. And then the baby, we need cap for the heart, and then socks, because we want to conserve heat. The baby will also be placed, wear diapers, and then when we place the baby on the mother's chest, we'll place a blanket on the baby. So baby blanket, and then optionally sleeves, a dress with long sleeves in front, so that the baby will wear it, open chest, and then we close it nicely. So another requirement that we have is privacy. So here you have the mother is lying in bed and the baby is here. I think this is depictive of a baby in the labor room, because KMC requires exposure of the mother, because you see the mother's breast, and this can be nervous and demotivating for mothers, because we also know that the breast is a symbol of beauty and it's also the private part of the mother. So when this is being taught, we have to ensure privacy and respect the mother's sensitivity with regard to her culture, and also promote this also whether in the ward or at the neonatal intensive care unit where we have limited incubators. This can be a very good source of thermoregulation, maintaining normal temperature for the baby. So what are the benefits? It prevents hypothermia, that is heat loss from the mother to the baby. So the mother promotes heat because she transmits her body heat to the newborn, and it prevents the occurrence of apnea, that is absence or breaking in breathing due to chest movements of the mother that stimulates the baby, and also prevent aspiration. I've said that, and it's also very effective in monitoring because the baby is in close contact and reduces the risk of infection, I said earlier. So these are some pictures showing us mothers. You see the mother is in the front, open towel, and this one also has her dress. The baby is in the heart, so the baby is warm. So you see, kangaroo mother care is not limited to the number of babies you have. Here we have one, the mother has twins. So you see she has her own binder, which is her own cloths. So she's able to tie it up securely and have it tied at her back. And then here you have the baby. The mother is in the ward and she has her single baby in between her breasts. So whether it's twin or single, kangaroo mother care can still be practiced. And here the father is involved. The father is the one doing it. So the father can also be part of the process so that it will promote bonding between father and son or daughter. So in conclusion, we are saying that maintaining normal body temperature in all babies is essential, and it's a very, very important if you want to reduce morbidity and mortality in newborn, especially in the preterm and low birth weight infants who have suffered some intrauterine or starvation in utero, so do not have good or adequate glycogen store in the liver, and some fats in the muscles are also inadequate. So if we leave them overexposed, then they will get cold and it will worsen their state. So it is very, very important that we pay attention to providing warmth and properly dressing our babies and promoting kangaroo mother care. Now we'll look at some assignments. We want you to discuss 4 mechanisms of heat loss and how to prevent them. The next is to enumerate the 4 benefits of kangaroo mother care. We'll look at the next session, which is hypothermia. Hypothermia is when the temperature of the newborn is greater than 37.5. So when the temperature is more than 37.5 degrees Celsius, it connotes fever, and it goes even as high as 38 or even 39, that the temperature is very high. And this is due to failure in thermoregulations that occur when the baby produces or is not able to dissipate the heat generated as a result of illness. So some of the things that can cause this are some drug reactions or some systemic infections. We talked about NIC or any other infection that can come as a result of caught sepsis or any other thing can cause fever. So signs and symptoms: when the baby is very hot, the skin gets hot and dry, and then there's also some degree of sweating, there is also dehydration, low blood pressure, and then there is tachypnea. The respiration goes above 60. How do we prevent this? Proper treatment of infection. Whenever there is any infection, it is very important that this is investigated and addressed. We do not expose the newborn to extreme heat, because sometimes when we have them placed under the radiant heater in the neonatal intensive care unit as a result of a procedure, and when it is done, there is a need to take the baby out and put it in the cot or incubator. If you leave it under the radiant heater, it gets extremely hot, and this can be very devastating. And look out for the components of drugs to prevent allergies that will also promote this. Management. There is a need to monitor the vital signs and move away from heat source and remove clothes when the temperature is hot, and also to allow cooling. So close monitoring of the newborn's body is very, very important so that we detect some of these things early. Some complications can be malignant hypothermia and then coma. So the next topic we're looking at is also hypoglycemia. So hypoglycemia is a clinical syndrome that results from low blood sugar, and this happens or is diagnostic when we say the blood sugar is below 2.6. So it can go as low as 2.2 or 1.65 in the first 24 hours of life, and thereafter, when it is in the first hour 2.2, but thereafter is 2.5 is diagnostic. And this occurs more commonly in babies born to diabetic mothers or newborns who are small for gestational age, preterm, or average for age newborns. So the causes, as we have mentioned, as we looked at the babies that are predisposed, you see that the causes of hypoglycemia include appropriate changes in hormone secretions. So when there is inadequate secretion of insulin that will help with the metabolism, this will result. An inadequate hepatic glycogen store. So we have said that in the premature, they lack this. So then with the slightest stress, they may be predisposed, or when feeding is not started early, they may be predisposed. An inadequate lipid store or muscle source store of fat. So which group of newborns are at risk? Newborns weighing more than 4 kilograms. These are newborns who have enjoyed some amount of hyperglycemia, and newborns who are less than 2 kilograms have also suffered some amounts of intrauterine growth retardation and therefore are predisposed to this. And also some newborns that have sepsis, or newborns who are preterm, less than 37 weeks, or also newborns who have symptoms that are suggestive of hypoglycemia. So you see some of the symptoms include irritability, seizure, apnea, and grunting, and the rest as you can see here. And the diagnosis from the physical examination, you will see that this baby will be exhibiting all the symptoms we have identified. And when you also do a random blood sugar, you detect that if it's within the first 24 hours of birth, the sugar level will be 2.2, or thereafter 2.5 and below is diagnostic. Prevention. How do we prevent these? Once again, it's by monitoring, and then also close observation, and then also keep records of glucose monitoring that we have, and then also we must also start early feeding and also proper antenatal care, so that we'll regulate mothers who are diabetics so that they'll be in normal controls, and where we identify some infections in the mother, they are treated And then whenever we see that the growth is not steady, but there is some retrogression, we address them appropriately so that the newborns don't suffer intrauterine growth retardation. So once again, we say that if the baby's condition allows it, breastfeeding should be started as soon as it is born. If not, it will predispose it to hypoglycemia. So initial breastfeeding is very important early, when started early. And if the baby suckle, and if not, we give 5% sucrose orally so that we prevent this. And we recheck again after 15 minutes, and then we repeat by giving bolus of 10% glucose, and then we feed on demand, but we keep rechecking. And then surgical management may be necessary if hypoglycemia is diagnosed in infants younger than 3 months. And this is done to correct the defect. Complications: we have lactic acidosis, we have insulin coma, we have brain damage, and even death. So the fifth topic we'll look here is hyperglycemia. So when the blood sugar level is high, is higher than normal. So when it is elevated above 7 or even greater than 8.3 millimole per liter, then we say it is diagnostic of hyperglycemia. And the medical causes are usually maternal diabetes and inability to replace fluid loss in infants, or dehydration will predispose them to this. And some medications, prematurity, and juvenile diabetes. So signs and symptoms are weight loss, fever, lethargy, and in severe cases, you may have ketoacidosis. So how do we prevent this? Proper management of maternal conditions, as we said in hypoglycemia, is the same here. And there is a need to monitor the drugs that we give to the mothers, and also the treatments of infections are done early in the mother. So when we notice this, we monitor the blood glucose level, we replace fluid loss if it is due to dehydration, and then we administer insulin when there is very high levels to prevent some ketoacidosis, because it also goes with some dehydration. And then we group all our nursing activities to reduce stress and allow rest, and consult the dietitian to also come and help plan the care when it involves older children. So ketoacidosis, coma, brain damage are some complications we can have. In conclusion, maintaining normal body temperature in all babies is very, very important to promote their growth and health, and especially the preterm and the low birth weight are high risk, and there is a need to monitor and also make sure that they are comfortable and well cladded, and also reduce morbidity and mortality significantly when we prevent and feed them early. So our assignment, we say that baby KA, a premature newborn, was admitted into NICU a week ago to start kangaroo mother care. Discuss the concept of kangaroo mother care for baby KA, and also the random blood sugar checked was 2.5 millimole. What does this mean? Describe your management of the diagnosis above. Take time to do this exercise and discuss it among yourselves. So our textbooks that you can refer to are on there, or any other pediatric textbook will help you with some further information.